Good morning and happy Tuesday, everybody. Dr. Stephen Zahm here hosting another episode of Tooth Teacher Tuesday. Topic for this week's episode is kind of picking up on where we've talked in the past along the topics surrounding root canals. So, another question that commonly comes up related to root canals and also to crowns is, let's say we've got a patient who, for any number of reasons, has been recommended by their dentist that they need a crown. The question that often follows that is something along the lines of, well, should I really do a crown? Because I've heard that when you get a crown, that means you also have to get a root canal on that tooth. And it's a fair point because crowns and root canals are somewhat closely related. And, it's almost kind of a which came first, the chicken or the egg type of situation. What I mean by that is, we talked previously that anytime a tooth has had a root canal, more often than not, we're going to recommend a crown afterwards because that root canal makes the tooth more brittle and fragile. And the crown is a great way to protect that root canal tooth. So most often a root canal does mean a crown. However, just because you need a crown on a tooth doesn't necessarily mean you need a root canal. Oftentimes crowns are recommended to protect teeth before they need a root canal. Crowns might be done for aesthetic reasons. Crowns can be done because there's a big filling on a tooth and we're trying to prevent that tooth from breaking. It can be any number of reasons to do a crown, but that doesn't automatically mean that you're going to do the crown and then afterwards need a root canal. Doesn't mean that you'll not need a root canal sometime down the road. Anytime we work on a tooth, even for a simple basic filling, especially if you get any dental work done and then don't come back to the dentist for several years. Fillings, crowns, any of it can go bad if we're not maintaining good hygiene. So a tooth that gets a crown could eventually need a root canal, but it's not an automatic guaranteed thing that, okay, you're going to get this crown and then a week later the tooth's going to start to hurt and you're going to need a root canal. I would say the most common reason that a tooth would need a root canal after getting a crown done would be that the tooth was already hurting and we suspected that that tooth has a crack in it somewhere. A lot of times, best treatment for a suspected cracked tooth or even a confirmed cracked tooth is to try crowning that tooth first to see if that crown holds the tooth together in kind of a bear hug and keeps that where that crack is from separating and creating that pain. Crown is kind of that first step. And that's where a lot of times, for me personally, if I suspect a cracked tooth, if it seems like a shallow enough tooth, we'll put the patient in a temporary crown and see how the tooth responds. If pain goes away, then we put the permanent crown on and we're good to go. If after that temporary crown is placed on, if tooth does not resolve over the next few weeks or months, then at that point we're thinking, okay, this tooth is going to need a root canal. So again, take-home message is crowns, root canals, they are closely related, but just because your dentist recommends getting a crown on a tooth doesn't mean it will inherently need a root canal in the future. So again, a lot of factors at play, and all the more reason just to ask these questions of your dentist just to make sure if there's any risk factors that could mean a root canal down the road. But hope this cleared up some misconceptions about crowns and about root canals, and As always, if you have any follow-up questions related to that, I'll be talking about more crown and root canal related questions down the road. So if you've got any questions to add to that, I'm happy to hear you out. So in the meantime, thank you for tuning in to this week's episode of Tooth Teacher Tuesday, and I hope you have a great rest of the week.